it's Kimberly here at Specialty Care Management. You may know us best for our passion for mitigating the high cost of catastrophic claims like those for cancer, air ambulance, our bill review accuracy and validation program for out-of-network claims. Also, our unique strategy for dialysis with our underwritten case rates, saving an average of 77.5% across our book of business. If we work upstream from dialysis, not needing dialysis saves you the most money. We have two programs with that as its aim. Our kidney disease program, chronic CKD management program, that's a program that's geared just for those members who have kidney disease. And through that program, through our specialty nurse care management program, we aim to help members either halt the progression and delay the start of dialysis or to improve the kidney function. Many members, when they are able to stop the progression early enough, they never progress to kidney disease. That's a whole lot of savings for your groups. Our Health Rates 360 program is my favorite program to talk about. It provides general population health in a smart manner while it focuses the nurse coach's time on those folks who are at emerging risk. Your folks at low, even moderate risk don't need to soak up a lot of nurse coaching time, but they do benefit from having somebody watch out for their claims, helping them coordinate communication between their providers. Things like, if they've missed filling a med, maybe reminders for a colonoscopy, reminder for their regular labs and exams, super important in helping those low-risk members stay low risk. You're going to find that about 6 to 10% of your general population is what we call emerging risk. These are members who don't have a crazy high cost claims yet, probably under $5,000, but they do have some comorbids and they do have gaps in care. These are members at emerging risk for becoming the highest spend for your groups. It's a matter of time. And we've talked about this before, but today what I wanted to share is a success story. One of our participants in our Health Rates 360 program, Mr. Case, when he started the program, he complained to the nurse coach, "My diet is not the healthiest, and I'm afraid they're going to put me on some more medication." He's a 36-year-old warehouse worker who's been told he has a touch of sugar, has high blood pressure. He's recently stopped taking his blood pressure medication due to some side effects that he didn't like. He has sleep apnea, but doesn't wear his CPAP, hasn't for years, and hypothyroidism. He complains of being tired. It's hard for him to get through the workday without being tired. And I'll just pause there. I have seen folks who have had so much trouble with untreated sleep apnea and the fatigue that it causes that they've actually lost their jobs. They couldn't perform their work anymore. Okay, I digress. He also complained that his cholesterol is too high. His doctor wants to put him on a cholesterol medication, but he doesn't want to take one more medication. The nurse coach spent time with Mr. Case to really understand his unique life and his situation. She did teaching about his diagnoses, about the pathophysiology at play. She taught him about the impact that sleep apnea had, not just on wearing this crazy mask, but she taught him about the impact that that has on his heart. And through her teaching, she was able to help him understand what labs to watch out for, what questions he might have for his provider based on those labs, and how watching out for a few key labs or biomarkers would really help him, empower him to take better control of his health. She did teaching about his medications. She helped him communicate with his provider to get his meds adjusted, and strategies for helping him cope with some side effects. Now, the common side effect, I didn't put it on here, but a lot of folks will stop taking a common med that we have for blood pressure. It's usually a first line med is lisinopril. It's cheap and it works well, but a common side effect is this nagging dry cough. So a lot of members will stop taking it because of that. But it's super easy. And most members, they just don't know how to communicate that forward with their physician. Having a nurse coach to help that communication process makes all the difference. So as she reviewed labs with him and taught him what to watch out for, she also went through with him the benefits of cardiovascular exercise, helped him develop his own plan and strategies for how he was going to incorporate activity and healthy eating on the run with his busy lifestyle. She also helped him to develop his own strategies for him devising for himself and for being consistent with his own habits of self-care. After her teaching regarding sleep apnea and the pathophysiology at play, he actually got scheduled for an at-home sleep study and started wearing his CPAP every night. Now he knows that he can actually work with his DME, durable medical equipment supplier, to help him find a mask that's comfortable for him and strategies for how to acclimate to that. He's been compliant with that and wears that every night. He also has had the support of the nurse coach to help him, like we talked about earlier, to really get the most out of his visits with his provider and really be able to communicate concerns forward in a more time-effective way. At his follow-up here with a nurse coach, he reported, gosh, all was good at my last visit. My doctor says he'll give me some time to see what my cholesterol does before we add another medication. He likes what I'm doing. So because of his work with a nurse coach, he's really put some focus on planning ahead for his meals and taking his lunches to work. He says he's eating more vegetables and fewer carbs. He's starting to actually enjoy his routine of aerobics and strength training 4 to 5 times per week. He's keeping his doctor appointments. He's having his labs done in a timely manner. He's also started checking his own blood pressure, and he shares those readings with his provider. And because of his efforts, his cholesterol has dropped from 268 down to 230. So it's on the downward trend. And that's really what his provider is, coupled with his triglycerides. Look at the drop in his triglycerides from 319 to 186. And oftentimes I'll see this when a doctor has or a provider has good communication with their patient, they can see what's going on. A lot of times they will give their members time to make some changes, especially when they bring forward concerns like this. They'll give them time to bring that down if it's not, emergent. Of course, it's a member's choice, but I will say most members, most of your group, your folks are going to make good decisions for themselves when they have enough of the right information and support. Now, his A1C also, he had this touch of sugar, pre-diabetes. His A1C was 6.0. A lot of folks are on diabetes meds by 6.0, and his A1C dropped down to 5.4. That's a 10% drop and huge savings there. So he avoided a new diagnosis, right? Doctor's not going to diagnose him with diabetes with an A1C of 5.4, and it's on the down, right? So there's a diagnosis that he avoided, and he's remained off of a diabetes medication. There's a whole lot of potentials for savings there. He reports that first week of changing his diet was rough, but now I feel great. I can't believe this stuff works. I have so much more energy now. My wife says I'm nicer to be around too. And he's bringing a little bit of that swagger with him to work, talking about increased productivity, huge. So the conservative savings breakdown for this member, he closed gaps in care. He had 9 gaps in his care. He's down to 0. That's a savings of over $11,000. With a 10% drop in his A1C, there's another over $11,000. So altogether, we're looking at almost $23,000 in savings. That's pretty robust. Now, not to mention, this member, like we talked about, he's not got a new diagnosis of diabetes. He's staying off of a cholesterol med. He's staying off of a diabetes med. As his blood pressure, and I'm not sure what his blood pressure was, but I'm sure it's okay, or it's getting better because he's on his med. As his blood pressure normalizes, there's savings there of $730 potentially. With a weight loss, so it's not on here, but this member's lost 6 pounds very early on. I expect that to continue. And with weight loss, we do see significant savings there as well, not to mention avoiding those comorbids. I tell you, I love stories like this. It really speaks to the power that proper coaching and intervention has for some of these members and the cost savings associated with that intervention. Almost $22,895 in savings pays for that program for this nurse, right? Our average ROI for our Health Reach 360 program is 5 to 1 because of stories just like this. I'll be happy to share another story with you later on in the month. In the meantime, love your kidneys and let's chat. If you like what you see and you want to know more, it's my favorite thing to talk about. Make it a great day. Bye, friends.